All right, well, I'm joined now by the Health Ombud Professor Malegapuru Makgoba. Prof, thank you so much for joining us. You know, when the video emerged of that Ashley Sauls took of pregnant women lying on the floor, there was such anger from the Rahima Moosa Mother and Child Hospital CEO. And it was a real turning point, wasn't it? We also, of course, had Tim de Meer's open letter as a paediatrician just saying how awful things were. That video is so shocking. But after looking into the hospital today, does that vindicate people like Ashley Sauls and Tim de Meer?
Definitely it does, but I think I just need to place everything in historical terms. The actual person who lodged the complaint was a member of parliament from the portfolio committee, because I think a relative or a friend of hers came to deliver at Rahima Moosa. And that's what sparked the whole thing. The source, I think, video and Tim Meyer's contributions obviously emphasize, I think, the importance of advocacy for patients and substantiated a lot of what had been seen. But as I indicated in this report, almost without exception, everybody of the 34 people who we interviewed confirmed the complaints that were lodged by Honorable Ismail.
Reading through your report, I think what is astonishing is that one of your recommendations is that the 2017 report titled An Unsafe Hospital, which looked specifically into Rahima Moosa, that the recommendations in that report should be implemented. So essentially, a report done 6 years ago, in all likelihood, highlighted a lot of the problems that the hospital is still dealing with. Am I correct? And how do you understand how an entire report is just ignored for 6 years?
If you are South African, you understand that we say a lot and do very little. I produced a report in 2016 on life as a demanding. It's still to be implemented properly at the moment. So in South Africa, there are lots of very good documents with good recommendations that are just, getting spoiled on the shelves or somewhere else. It seems to be part of our culture to speak a lot and do very little.
But it's absolutely unacceptable because we're dealing with dignity, with human rights, with individuals' basic rights to good service, to good health care. Does that mean there's a risk that this report, which vindicates the whistleblowers, which says that conditions are inhumane, could also end up dusty on a shelf somewhere? Do you have any teeth to make sure that action's taken?
I don't have teeth, but I have a sting, which is what I do. Mm-hmm. I have a trust in Premier Panyaza Lesufi and MEC Nobantu Lihoko, because I had confidential meetings with them about this report and to reflect on, my experience of investigating hospitals here in Gauteng. And I think they seem to have woken up, but, as they say in English, I think the proof of the pudding is in the eating. So Panyaza Lesufi, I think, is somebody I trust, and I have confidence that he will do what he says, and I'm looking forward to that.
Your report also deals, look, the reality and the context, of course, is that this is a hospital that for a number of years has had very many difficulties. But let's focus on the CEO for now, because your report recommends a fit-for-purpose CEO, as you put it. You found that the current CEO was found basically missing in action for a lot of the time, many days taken off without actually accounting for them. But in your report, you suggest that she actually be transferred to the Provincial Health Office. My understanding from our reporter, Slindela Masikane, is that has already happened. Why transferred to the Provincial Health Office? Is there a specific reason that you made this specific recommendation?
It's a recommendation. I think if one reads my writing carefully, it's a recommendation I supported, because by the time, I think when I started the investigation, it became obvious, I think, even to the people in the province, that they have to do something. I think with regards the CEO, and they didn't have to consult me because I was just an investigator. So what they did was to transfer her from the hospital and bring her into her office. And all that I did in my report was to say, I support that because, I think the whole purpose of my investigations is to find solutions that strengthen the system rather than weaken the system. And I had every reason, I think, after interviewing the then CEO, that I think she needed, I think, lots of support, because in my interaction with her, she said to me that, she had just been thrown into a lion's den with very little support in an environment that was alienating. And I had to take all these factors and ask myself, is this the best thing that the province could do? And they had already done that. So I accepted that finding, but I placed it on record that she needs to be supported and be trained, and also, I think, be given some form of treatment that she had already also agreed with the Health Professional Council of South Africa, so that she can be rehabilitated.
All right.
At the end of the day, this is a qualified doctor who is quite bright, and I think requires support rather than, I think, blood on the floor or something like that. I don't think that would be appropriate, and that would not be the right, I think, recommendation to make. Give a chance again.
I hear you, and the subtext is that there's clearly another health issue, and there's another whole conversation, which there's extenuating circumstances, perhaps. But bright doctors don't necessarily make great managers. You need someone who really understands supply chain management, financials, how to get things done. The fact that the wrong person was put into that position, such an important position, also raises questions further up the chain. Her boss, her boss's boss, the political heads, that they didn't intervene when clearly from 2017 at least this hospital was in distress. You said to me that you have faith in Panyaza Lesufi as the Premier, that he's really going to make sure change happens now. But if we look at a lot of hospitals across the country, they are in dire straits. How confident are you that this report's really going to perhaps sort of open the whole situation up so that accountability goes up the chain as far as it goes down?
I think if you had to look at the history of my reports that I've done, both here in Gauteng and in the Eastern Cape, I think collectively, I think they speak to a lot of accountability. They often, I think, put responsibilities actually on the political leadership, especially in the provinces. And that seems to have lagged behind. And as I indicate in this report, there seems to be a problem of how you select leaders in this Gauteng province compared to the rest of the province in the country. And I think that needs to be fixed, because we're dealing here with a special a province in our country that contributes a third of our GDP. And also, I think it's the most popular and dense province that we have. And if we don't fix health and education in this province, I think we're going to be in trouble for a very long time. But as I say, when I did have private conversations with the Premier and the MEC, I left there, I think, with some confidence that I think maybe we're beginning, the penny is beginning to drop. Whether it will take a little bit longer, a little bit more pushing, I don't know. But as I say, I do have confidence in Premier Lesufi.
Of course, the context has to be included. Within that, we have to include the reality of load shedding. And I remember Tim de Meyer's letter talking about doctors driving to various hospitals to try and get supplies, but also doctors having to perform operations with the light of their cell phone because of load shedding and the generator was kicking out. Water supply problems at this hospital as well. Those are issues that many hospitals are grappling with. But at Rahima Moosa specifically, are you aware if things have got any better in the last few months at this hospital? Is it safe to actually go there and birth a child?
I think it never stopped anyway, even during the time when I was doing this investigation. So that continues. But I think this afternoon when we were with the MEC, I think she did list a few things that have gotten better. I think the leadership are now focused, because I think the whole country is now focused on Rahima Moosa. But I think there has been attempts, I think, to improve on the situation at Rahima Moosa. And really, I do think that there are enough responsible and experienced people at that hospital to make a difference and make a change. Yeah.
All right. Well, I want to thank you so much for shedding light, and I know that you're sitting in darkness due to load shedding, but shedding light on these conditions and trying to get accountability, as you say, very little around life esidimeni, which you also looked into. And I think that you also did a report into mental health care facilities in the Eastern Cape, if I'm not mistaken, a few years ago. That, of course, is the Health Ombud Professor Malegapuru Makgoba. Of course, he released his report today into the Rahima Moosa Mother and Child Hospital here in Johannesburg.